Hello, I'm Tony Trongone, Superintendent at Millville Public Schools, and I'm here to provide you an update regarding our reopening of schools. In today's session, we'll have information provided to you by our Assistant Superintendent for Human Resources and Student Services, Mrs. Donna Meyers, COVID-related guidelines and also student immunizations. Following Mrs. Meyers, we'll have our Assistant Superintendent for Curriculum and Instruction, Dr. Pamm, talking about when are we returning to in-person learning, and also the communication process with parents between now and the return of in-person learning. So I'm going to begin our questions with Ms. Donna Meyers. Welcome, Ms. Meyers.
Good afternoon.
And I have a couple questions for you. So I have really four, and then five is another piece. But the first question is, there's been questions about the travel advisory. So travel advisory guidelines and traveling outside of New Jersey as prescribed by the Department of Health of New Jersey. Can you fill us in on those latest guidelines?
I certainly can. So the travel advisory currently, the only states that are excluded, if you live in New Jersey and you travel to Connecticut, Delaware, New York, or Pennsylvania, they are not part of the advisory. We can travel to and from those 4 states only. Any other state, or if you travel internationally, you are going to have to quarantine when you return from those areas. So what I want to make clear is sometimes family members, the mom or the dad, or have to travel out of town for something. We're talking about our students. So if you went on vacation and you took your children with you, they are the individuals that would have to, you have to quarantine, but they definitely have to quarantine from school. So if they did not travel with you, you are the person that's quarantining. If the student traveled with you, they would need to quarantine. So when you return, on the day that you return, if you elect not to get tested, the guidelines say that if you get tested after the 3rd to 5th day, so you come home on Monday, you get tested on the 3rd or 5th day and it's negative, you don't have to quarantine 7 days from that day you return. So 7 days from that Monday. And then you can return on the 8th day to school, the child can. If you elect not to have your child tested, your child has to quarantine 10 days from the day you returned. So you returned on Monday, they have to quarantine for 10 days before they can return. So that's basically the guidelines. I just want to make it clear that it really is the child. It's not family members or somebody came to visit you from Florida. It's you traveling. You're the person that has to quarantine. And again, 3 to 5 days get tested. You only have to do 7. You don't get tested, you have to do 10 days of quarantine.
All right, thank you.
You're welcome.
Please explain what is a close contact and the guidelines if your child is a close contact.
Okay, so close contact is considered that you have been in close contact with someone who is positive and that you were less than 6 feet from them, were not wearing a mask, and spent more than 15 minutes within a 24-hour period. The mask, just because someone wears a mask, if you're still closer than 6 feet and you spent more than 15 minutes with that person, you are considered a close contact. If you are identified as a close contact, you do need to quarantine for 10 days from the date of your last contact with that person, or 7 days with negative test results. And those test results have to be collected on day 5 or 7. So if you're a close contact of somebody on Monday, you have to wait at least 5 days because they consider 5 to 7 days to be the incubation period. So you are a close contact with someone on day 5 through 7, you decide to get tested, you're negative, you would be able to return to school. If you are not tested, you have to do the 10 days. And then we have to follow the regional risk levels. So we are in yellow or green, or orange is high, which we are high now. If we're in those levels, you'd have to quarantine for 14 days. So those days really are connected to what's the risk level in the county at the time. And the nurses have that information. So if there's ever a question about the level, you can certainly contact the school nurse for that.
I was going to ask you that because it's a lot of information, but if there's needs to be clarification, contact your school's nurse.
I do just want to add something out about close contact because there's a lot of questions. Why isn't this classroom, closed, or how come the school's not closed if there's close contacts? Again, even in a classroom, your son or daughter could be sitting on the other side of the classroom from a student who's considered positive and has not had any interaction with that person, that child. So they were never 6 feet, less than 6 feet with that person. So if those guidelines, if you don't fit that category, you're not considered a close contact. So it doesn't always mean if there's one student in the classroom who's positive that that whole class has to be shut down.
That's a great point to make because that happened earlier in the year, and the parents should know that. So thank you.
You're welcome.
Third question. What are the current guidelines if your child tests positive for COVID?
Okay, so if your child tests positive, they have to quarantine 10 days from the date of the test results. Again, we are going to look at regional risk levels. So that's if we are in the low to moderate. If we're in the high level, we're looking at 14 days. And again, it's from the date of the test result.
Okay. What are the current guidelines if your child has COVID compatible symptoms?
Okay, so this is a new guideline. So if your student has COVID-like symptoms, before you could get a note from your physician saying they believe your child has a common cold and your child could come back to school. The CDC and the Department of Health is not recommending that anymore. So if your child has any of the symptoms, so they have chills, a headache, sore throat, they're fatigued, they have loss of smell or loss of taste, then they are going to be required to quarantine for 10 days. And then they also have to be symptom-free after those 10 days. So if they had a fever, they need to be 24, after that 10 days, they need to be 24 hours free, fever-free, without medication. The thing that is going to change the most is that if you have 4 children living in your household, they all go to, they each go to one of our schools. The siblings must also quarantine. So if I have a sore throat and my children lived at home, they would have to quarantine as well. And they have to quarantine until I take a test. If I'm negative, everybody can go back to school because nobody was positive. We just had symptoms. But again, the siblings or anyone in that household, some people have other individuals living with them. If they go to our school and one person in that house has COVID-like symptoms, everyone has to quarantine until that person is negative or the 10 days.
So I have one more question for you, and you have a closing comments, I'm sure. But these guidelines where do they come from? Let the public know where they come from. I know we talked about it in previous communications, but can you just tell people where they come from?
Absolutely. Those guidelines come from the CDC and also the Department of Health. I am in communication with the Department of Health, definitely weekly, almost daily. So I work with both of those groups. And the Department of Health usually sends me the updates from CDC. So those 2 groups are the main groups that give us all the information, the guidelines, and the protocols that we need to put in place.
And the reason why I ask you that, Donna, because this is not a Millville schools policy. And I know the public will know that, but I just want to reiterate, this is not a Millville public schools policy. This is a state policy that we have to follow that.
Correct. Mm-hmm.
Okay. Also, in every year, we always have issues. All schools have issues with the timeline for immunizations. Can you fill us in on that particular issue as the school year? We're in February now, so we've also been handed out guidance on immunization. Correct?
Mm-hmm. Correct. Every year we have immunizations preschool, entering kindergarten. Our largest group are our 5th graders heading into 6th grade. So these immunizations are a requirement. We cannot overlook them. We've tried to work with families, getting information out there, sending reminders and report cards, and at the end of the year, nurses making phone calls. We just recently sent a letter to parents as well. And although we may not understand or agree with virtual students, they are still required to have immunizations. So unfortunately, we do still have a number of students who have not met or are non-compliant with our immunizations. And come this Friday, they will not be able to participate in our virtual or be able to participate when we return. And that's unfortunate. We really do want all of our kids to be able to participate, whether it is virtual or in person. It's extremely important. It's been a tough year and our kids are already somewhat behind and we don't want them not to be able to participate. So I do urge our parents, you can contact Complete Care, which is in Millville. We do have a memorandum of agreement with that organization, and they, can offer immunizations for kids. So it is extremely important so that your child does not lose any more educational opportunities here, that they get vaccinated as soon as possible.
And again, we reviewed this at school, and we had made attempts with the Department of Health to say they're virtual. Where's the harm in to maintain the instructional program while they're virtual? Because we thought it's rather, I don't want to put a word to it, but I think the public needs to know that you've inquired about that more than once, in the logic of their home. But we were told, no, we have to maintain that particular guideline, correct?
Correct. And we get audited. The district will be audited, and we will have to explain if we have students who are non-compliant, why we still have them in the system. So, we are obligated by law to enforce, to comply, I should say, with immunization. So,
unfortunately, we have to do that when they're home and virtual.
mm-hmm.
Any more closing comments, Mrs. Meyers?
I do just want to remind everyone about masks and make sure that when we return, our children do have masks. I know the district did provide some, and I know that if your children need masks, that we could still help out with that. But just for those who are going to return to the hybrid, just remember, and this comes from the CDC as well, gaiters are not acceptable. A face shield is not acceptable unless a mask is worn under that face shield. And then for anyone who has any kind of medical condition that would prohibit them from wearing that, they can please let their school nurse know. And with documentation, we can work with those students as well. And another point I'd like to make is your contact information, especially during this time when we do have to reach out to parents in case someone's a close contact or someone isn't feeling well. If you could update that information in our system and your emergency numbers, that would be very, very helpful to us. So in closing, I just want to ask, please, let's work together and notify your child's school if your child should travel outside of New Jersey or internationally, if your child has COVID-like symptoms or they test positive. This is all information that we need so that we can ensure that your child and the rest of our students and staff and community are healthy and safe. So your cooperation is greatly appreciated.
Thank you, Mrs. Meyers. And I got to add that I've been in contact with the Cumberland County Department of Health, and they nothing but just send platitudes to me about the work that you've done with them and the communication and how we've handled all the cases from really August all the way forward to today. So thank you for your work in this area.
You're welcome.
Okay, thank you. Next up, we're going to have our Assistant Superintendent for Curriculum Instruction, Dr. Pamm Moore. And I have a couple questions for her.
All right.
I guess this is the big question, Dr. Moore. First question is, when are we returning to in-person learning?
Thank you for that question, Tony. We've been working very hard with our school reopening committee, which is comprised of teachers, paraprofessionals, school nurses, our administrators. We've been working very hard in the last couple of weeks to make a determination about when we will be returning and how we will return. So the answer to that question is we will be returning on February 16th, which is the following Monday after this week. We will be returning back to our hybrid and virtual schedule, and it will be a full day schedule. Tony, if you could just pull up the calendar for me, our orange and blue calendar. Thank you very much. Previously, when we sent this calendar out, the week of the 16th was going to be an orange day and then remote. So the only change we made to the schedule is that we will have 2 orange days and 2 blue days in the week of the 16th. And then the following week, we will return to our orange, remote, blue schedule. So the students who will be returning will be all of our orange and blue students. Students who were virtual will remain virtual or will have the option to remain virtual. Some students, however, will be returning 4 days a week. The students who will be returning 4 days a week are our self-contained population, grades K through 12. Those students who have been identified resource room students in grades 6 through 12. All special education students with one-to-one aids, all preschool ages 3 and 4-year-olds. They will all return to a 4-day schedule: Monday, Tuesday, Thursday, Friday. Wednesday will continue to be a remote day for all students. And we will, again, continue to provide a virtual option for those families who wish to have it. And Latchkey will be provided for those families who utilize those services.
Okay, I have a question on the special ed self-contained. Is that grades 6 to 12 or K to 12?
So the special ed resource room, that's just 6 through 12, because those populations are in a more of a self-contained population. Our resource room students on the elementary levels are not in a self-contained population.
All right, thank you. So I think we're looking forward to having our kids back on the 16th.
Yes, indeed.
So you mentioned our reopening committee. We've been meeting, and we've been meeting the past 2 weeks, and it's a broad outreach to folks in regard to reopening, and then the conversations about all the different scenarios and concerns that we have, and we try to. It's some good conversation about what we need to do to open up the school, and then the spirit, in a sense, of a safe environment for everybody to come back in, but also we know that the kids need to be back. And so, but the biggest question, our biggest concern was communication with parents. And you and the principals have been working on that communication to parents. Can you extend that as far as what we're doing, as far as from now, February 2nd to February 16th, in regard to a smooth transition to in-person learning, and the parents, what they need to know?
Absolutely. So the committee last met yesterday, and we made this decision to return to school on the 16th. We made this decision yesterday. So the committee really has not had a lot of time to turn around information, and we don't have a lot of time to turn around information for families. So our timeline is very short. So as soon as we are able to return to school based on the weather, letters will be going out to families indicating where your child was when we left in November. So that means whether they were in the orange group, whether they were in the blue group, or whether they were virtual. So those letters will be going out as soon as we are able to get back to school. And you'll be able to make a determination at that time. Do you want to continue in the hybrid model? Do you want to go to virtual? Or if you were in the virtual model, would you now like to have your child come back in the hybrid model? If you wish to make a change, there'll be information in that letter that directs you to your school's website, where you'll be able to sign the form that states you wish to make a change. So again, those letters will go out as soon as we are able to return to school, to get those letters out to you. But we're asking parents, if they wish to make a change in their child's delivery of instruction, to make that change by the 8th. And again, I know that's a very short time frame. However, we need to be able to provide enough time for transportation to make any changes, so that we're able to accommodate all of our students on the bus as well. So all parents will be directed to their child's school website. You are also always able to reach anyone at the board office. And the schools have been outstanding in providing information. And Tony, you just mentioned the school reopening committee. I just want to say that committee has worked tireless hours outside of their regular day to make sure that we can get students back in a safe and secure manner. And every last one of those individuals is committed to getting students back into school.
I was going to ask you for closing comments, and I think you just did that. But again, I am concerned about the planning. So The
Yeah.
deadline for that switch from either virtual to hybrid or hybrid to virtual will be next Monday, the 8th.
That is correct.
And that gives principals time to make those, because we have to abide by the CDC guidelines with social distancing in the classrooms. So
Right.
they need time to prepare. And also, we have to deal with the transportation and also food. So that's an logistical issue we have to iron out before the 16th. So Dr. Moore, thank you for your leadership in this area. And I just want to say to everybody, this is our first step. We're looking to open up on February 16th, and we're going to do what's best for our kids and best for our staff. And we'll have more updates as needed, predicated upon, again, the needs of what's going on to open up on the 16th. But then also, after the 16th, what do we need to do looking forward in regard to 2 weeks later? What does school look like? People are jumping ahead and wanting to say maybe we can go back more days than what we have in hybrid, but we have to first start where we left off. Our last day was November 24th, and I can't say it enough. That's the schedule we'll be following when we come back on the 16th. The reopening committee will meet and talk about what we need to do to progress into bringing everyone back, if it's possible. And so we want kids back in school, simply said. So I want to say thank you for your time, and go Bolts. Thank you.